because it has been found in different registry in which were done on heart failure patients in India that the survival rate of Indian patients, Indian heart failure patients, is quite low compared to the global counterpart. So what is the reason why it is quite different? You will be surprised to know that the mortality, in-hospital mortality for the heart failure patients internationally, it is around 3.8%, but in India it is near about 30%. So it is almost 10% high, 10 times higher mortality. Then again, the survival at 6 months is 8.6% in the world scenario, but in India, for mortality at 6 months is almost 26%. So that shows that we, in India, we have heart failure patients who are much sicker, who are having a very bad prognosis, and their outcome is much poorer compared to their global counterparts. So in India, we have to be more cautious, we have to be more aggressive, we have to treat these patients with utmost intelligence and with utmost care to avoid this kind of high mortality rate, which is even much higher than any of those cancers which I have already mentioned. Now, what are the reasons why Indian patients are at a very high risk of mortality from heart failure patients? Now, if we see the demography of the patients or the patients cohort of heart failure patients in India, you will be surprised to know that the patients actually present at a much younger age compared to the global counterpart, because the average age for the heart failure patient in international patient is 73 years, whereas in India they present at around 53 years. So these patients in India, heart failure patients, present almost 2 decades earlier, number one. Number two, they usually have an associated severe LV dysfunction, means these patients are much sicker compared to those those heart failure patients who we see in the international hospitals. So that shows that in India the heart failure patients are actually presenting at a much younger age, number one. Number two, they have a very sicker profile, they have a very high, severe LV dysfunction, or they have a very severe heart muscle weakness, and at the same time they are associated with severe coronary artery disease, and they have a very high association. Almost 42% of these patients have associated hypertension as comorbidities. The reason being, as all of us know, that in India coronary artery disease is also increasing at a rapid pace, and that results into left ventricular dysfunction, and ultimately these patients go on to develop heart failure. And particularly all of us know that in India very few centers are capable of doing primary angioplasty in heart attack patients. Only in few of the cities we have this facility. Many of the rural backgrounds, we do not have the facility of doing a primary angioplasty when a patient suffers from heart attack. So suppose a patient is in a remote place or even 200 kilometers from a city and suffers a heart attack. By the time he reaches a hospital which have a facility of doing an angioplasty, almost 10 to 15 hours will be passed. So these patients, though they will undergo angioplasty, they will have a profound heart muscle weakness, for which these patients in later life they will develop heart failure symptoms. So that is a reason, I think, because of the not proper control of coronary artery disease and heart attack, in India is having a very high amount of heart failure patients, and at the same time they have a younger population who is suffering from heart attack.